Okay, so GV went into great depth on cognitive load, and I'm going to cover it in a similar fashion, not as in depth, but kind of start bridging between what to expect as a faculty, uh, what is concerning the student, and how we kind of interface with that. Just quick overview: intrinsic load is the difficulty of the information to be learned, and this is content dependent. So as GV had mentioned earlier, the more you know, the easier it is to learn more. And it's a great way of handling the load. But as a faculty member, you don't get to control that. Extraneous load are the distractors. And considering the limitations of working memory, this is something as a faculty member, either in a classroom or a clinical setting, this is what you want to decrease as much as you can. And then germane load is simply the difficulty in learning new information. And there are certain things we're doing here within the School of Medicine to kind of promote that. Next slide, please. So this will look fairly familiar to what GV already presented. One thing to keep in mind is the sensory memory component. Humans process all the information in our environment. And so that's potential grounds for extraneous cognitive load. So you're trying to learn in a distracted place, the classroom is distracting, or you're in a clinical setting. And I feel for you with all the beeping and buzzing and the intercom stuff as you're trying to teach. That information is competing with your message. Selective attention is purposefully, as the learner does, is pull it into the consciousness, the working memory. And you can work with 7 plus or minus 2 bits of information. It's called Miller's magic number. And after about a minute, if you don't do anything with this, it will decay. Now, this is something that it's helpful to understand how the learner processes, is to ask, well, what did you do with the information? So understanding the limited capacity, when students engage in redundant or repetitious strategies, well, they're keeping the information active in working memory, but aren't necessarily encoding. And you'll notice in red under the long-term memory node is schema. So organized bodies of knowledge. And we all develop that organization, but there's a lot of benefit in presenting organization. How you present the information can help to develop the schema quicker. The quicker the development of the schema, the quicker the student masters the information you're teaching. And how something's organized really, relates with how it's retrieved. And then sitting on top was metacognition, and that's just really managing the whole process. And we want our students to think about this, but we also want the faculty to think about this. What is going on? Okay, next slide. So breaking encoding into these lists here to compare and contrast internal versus external. So encoding is the process of connecting new information with what's already existing in the long-term memory node. Now, internal is you're finding connections within ideas being presented, i.e. representation. So can we go back to the previous slide? This is a representation. So as a faculty member, I could have broken this down into a linear sensory memory and then presented on that, maybe hit selective attention, but then in a linear fashion, I could have presented that, but I would have created load in that process. Whereas here, using a graphic organizer or a representation to teach to or teach from, hopefully is promoting that structure that we want the students to take away in development of schema. So next slide. So examples of the representations we promote are matrices, diagrams, sequences, and pathways. And we're trying to get students to find, okay, what are the patterns within? And then promoting external connections is connecting, kind of using analogies, examples. A specific tool our students use would be, say, sketching. It's using visual connections with mnemonics, and it's powerful. It's not the end all be all, but it is a great way of developing that schema. And students always talk about the bear with the sausage wrapped around its ankle. I don't know what that means, but it must be a powerful tool because everyone remembers it. Next slide, please. There we go. So, promoting representations to develop the schema to reduce the cognitive load are strategies that we promote and that we try to accomplish. Another learning strategy. Now, this GV had mentioned Richard Mayer's work for the multimedia learning. I worked with my advisor, Ken Kira, to develop this model back in the 90s, early 2000s. Anyway, it's kind of a ripoff of Richard Mayer's work. He had a model that covered everything, but the metacognitive or self-regulation was implied in his model. That's the only difference between his and Ken's. But when we work with students, we promote with the selective attention component is note-taking, attending to the message that the faculty member is presenting. And one way to really prepare for that is previewing. Now, we ask them to preview just to know the lay of the land, not so much to kind of create the problem GV mentioned of unlearn or unteaching and reteaching a student, but we want them to know what's coming. And this has been shown in advanced organizer research. This goes back to 70s, 80s. It's been a while. But just knowing what is coming frees up working memory capacity to not have to worry what is coming next, but I know how this story ends. I know where it's going. So we'll ask them to preview and then take notes. Early 2000s, before Sweller really took off, faculty were saying, well, don't take notes, just listen. And that was actually found to be not the case. It's better to take notes. And then organization is kind of what we're talking about, where we're promoting representations and matrices. Picture's worth 1,000 words. Matrix, the tables and charts, it allows students to understand the coordinate relationships. So what something is and what it isn't, but it also promotes finding internal connections. Again, we want that schema development. With a limited working memory capacity, we want that to be as effective and efficient as possible. Encoding is the association of the information, connecting it with what you already know. And that is going beyond the kind of redundant strategy approach. And it's making sure I am physically connecting this to what I already know. Because the worst part is when students think that they know something, but they only understand it superficially. I read it 3 times and things can go haywire. And Kiely's going to pick up on that point on her presentation. But you don't want someone who already has a limited working memory capacity to start to believe that they can't learn something. So regulation is the last component of this method. And you can do this myriad ways, but the point is that you hit these 4 research empirically supported methods or components to get the most learning out of this. Now, the regulation, we promote questions, and in the first 2 years, we're using RX as our product that we provide to the students. And the point is, okay, I want you to learn stuff. You're developing a schema, but the answering questions will let you know, well, how well do I know it? And it also develops that more dynamic, higher order thinking as opposed to just memorize and move. We don't want that. And then building on this, we developed supplemental instruction. Now, you'll be happy to know this, faculty, is we use your materials. at least for the first 2 years. But it's important that we guide students to your expertise. And so we're not undermining, we're using your materials, but we're guiding students' use of generative strategies to address the cognitive load limitations. And so what we do is we meet on Wednesday nights and we go over that week's material and we reorganize. We create representations as you see, an example on your screen. And we try to consolidate information and make patterns explicit. Now we'll give pre-work with incomplete representations. And then during the SI session, we'll complete that. So a caveat with this kind of approach is you don't want to give them everything because then they tend to superficially structure this. Whereas germane load is a good thing. And we want that. We want effortful practice. So we want to provide some scaffolding for them to develop the structure, but they have to do the work. So we don't want to completely remove all of the load on the student. And then next slide. So in a nutshell, we want to address cognitive load. We want to improve the learning outcomes. So on our end, we're trying to promote the strategies that we want the students to engage in to be the most effective that they can be. But it's also important that well, what are they doing? And then you can also consider this as an expert teacher. How many times have you asked a question of your students and you got nothing but the 1,000-yard stare? You picked up on that retrieval and said, they don't understand a thing. I put them into cognitive load, they're shut down. So then you have that opportunity to readdress it, do informal assessment, to probe, to see, well, what are they getting? What are they not getting? But knowing that students have this limited capacity, think about the content, say, immunology. It's really tough. But many students come to us without any background knowledge in it. They have nothing to start with. So you're gonna start off with high anxiety, but it puts a lot of pressure on you, the faculty, to deal with that. Now, part of the reason we use graphic organizers in SI was the variability in the students, the background knowledge. It's very difficult for you to teach to the middle when you don't know where it is. It's very difficult for our students when they're spread out all over with their background knowledge. And so what we want to do is promote this more structured approach, guide them to develop higher order schemas. And as we discussed earlier, the more you know, the easier it is to learn more. And as we develop to that clinical reasoning. Now, one thing that is a slippery slope with cognitive load is if we don't manage it, or if the students don't manage it as well, you can damage their implicit theory, develop a fixed mindset. I can't do fill in the blank. I'm not good at fill in the blank. Medical students and health science in general, they're rife with imposter syndrome as we get them. And so we don't want to damage them more. So improving the quality instruction is, now that you know that, say, the sensory memory, your students are processing everything in their environment, manage it, reduce it. Avoid the split attention effect. Now, GB hit on Mayer's work, but one thing that needs to be added to that is the split attention effect. And that's when, if you have very dense slides and you're already out, beyond the 7 plus or minus 2 bits of information on a slide, if you read it to them, you're hitting both modalities and it's causing interference. It's called the split attention effect. So what Mayer is alluding to is he was like, use both, bounce back and forth. But if you're reading your slides, you tend to create that split attention effect, which actually decreases comprehension as well as engagement. And so the long and short of it, we want to promote learning. And with that, I want to hand it off to Kiely.
Thanks, Jeff. Okay, so with the little bit of time we have left, I just wanted to share a little bit more about the student perspective. So Jeff and I both work in academic success with our medical students in Omaha. We also have experience at the undergraduate and master's level, as well as the PA program. But these are the things that students are often coming in and sharing with us. I would say kind of the most common frustrations or issues as they come in our door. One being that I fall behind early in a lecture, and then the rest becomes a waste of time, or I'm completely overwhelmed with the amount of information. So these would be our students, as both GV and Jeff discussed, they're novices. They don't have those schemas yet. So it's very easy, if they're overloaded early in a lecture, that they just can't keep up and they stop learning from that point forward. We'll also hear that they struggle with learning objectives sometimes. They just don't know what they need to know, and they're getting stuck in details. They're trying to memorize little bits of information, and they're just not understanding the big concepts that they need to know when they go in to take a test or an exam. And perhaps the worst, I'm losing interest. I don't know if I ever should have gone to medical school. I don't think I like this. And those are the ones that, are just so overwhelmed that they've now lost their motivation and they're just having difficulty persisting in the face of those challenges. This fits with probably a lot of what you see with your students, and definitely what we see working with our medical students is the strategies aren't great. So you can see on the left, these are students saying that they use the strategies. On the right, you can see the number one strategy is rereading. So we see a lot of students just rereading their notes, maybe even passively just reviewing lecture slides after a lecture. We see a lot of rewriting of notes. Again, these things can become very passive. These students are putting a lot of time into their studying, and they're seeing very little benefit from that. So some of the advice that we share with them: to be actively engaged in lecture, take notes, ask questions, try not to just lose their focus in lecture. Afterwards, we tell them, let a little bit of time pass, then we want you to review and consolidate that lecture. So this is where the learning objectives really come in. As GV said, they need explicit instruction. They need to be told what's important and what they should be getting out of each lecture. The retrieval practice is huge. So, and we're not just talking about using practice questions or practice tests right before an exam to help students figure out what they know and what they don't know. We ask students to do this early. That retrieval practice just makes retrieving the information easier later. It's helping them get it into that long-term storage. So after a lecture, they can write down everything they remember. They can fill out learning objectives. They can find practice questions, use flashcards. Each time, they're making it easier for them to retrieve that information later. As they're doing this, we're also telling them to check their notes and their lecture for accuracy. Dual coding, we touched on that quite a bit already, but combining multiple modalities gives them a better opportunity to not only encode the information, but there's two ways to remember that information later. And not to overlook, just encouraging them to be curious. It's amazing in medical school, we have these really bright, excited learners. In week one, obviously they wouldn't come to medical school if they didn't like to learn. And very quickly they get caught up in the memorization and getting overwhelmed with the content. And they forget that this is interesting stuff and they came here for a reason. It's always fascinating to me when we kind of encourage students to just take a step back, not worry about a perfect grade or memorizing everything, and just to have a little bit of fun with it, that they actually end up doing better in terms of their performance. The last little bit I'll touch on here is just how important student self-perception is. And there's some difference between academic self-concept and academic self-efficacy, but both of these are the learner's perception of whether or not they're going to be successful. And this goes way back to Bandura's kind of seminal article in the 70s, that unless people believe they can produce desired effects by their actions, they have little incentive to act. So it's not surprising that student self-perception, both efficacy and self-concept, are very strong predictors of academic achievement and academic engagement. We see a recent article that actually just came out in Academic Medicine that was specific to academic self-concept, but this is predicting student performance. So how they're doing both pre-clinically, how they're doing in courses, as well as their performance in their clinical clerkships. So this is not just fluffy. We want our students to feel good and, be motivated and positive, but I think we can all, say that there's pretty convincing evidence that we need to at least consider this in terms of our lectures and how we're designing instruction. So with the interest of time, I'm not going to go into this one, but there is an article, I have it in the references if anyone's curious. This was specific to medical education, but about kind of 5 ideas for effective instructional strategies, considering self-efficacy and academic self-concept. And I just want to end with this because I think the end goal is, yes, we need to teach students, they need to be knowledgeable, they need to have a lot of skills, but it's not enough to just have the knowledge. And we need to also foster the efficacy beliefs and just give them, kind of the intrinsic push to just be interested and curious. Because if we don't do that, the knowledge and skills don't matter. And, for the most part, they will not be successful in terms of being lifetime learners. So wanted to leave a couple minutes in case there are any questions. These are the references. And I know, Jessica, we need this slide here at the end.
Thank you so much, Kylie and Jeff and GV. We appreciate your time and sharing of your knowledge for faculty use, but then also learner use, because we're all still learners as well. So there's things that we can do for our own learners, but also for our own learning. So appreciate your time. If there's any questions, we'd love you to just unmute and have a conversation.